Welcome to Healthy Living. I'm Pat O'Meara, speaking to you live from our studios tonight. And we have a very interesting subject to talk to you about, something that's quite new here in Fort Lauderdale and here in South Florida. Welcome to Healthy Living. Tonight we have as our guest Dr. Andres Mencia from Broward Hospital District. And Dr. Mencia specializes in adult and geriatric medicine. And during his education, he received several honors, including Intern of the Year and Chief Resident at Mountainside Hospital in New Jersey. Was voted Best in Geriatrics here in South Florida by not only Miami Metro Magazine, but also by his peers. And Dr. Mencia holds several medical directorships, including ACTS Retirement Life Communities, Palm Court Rehabilitation and Nursing Home. And he's also an associate professor of geriatric medicine at Florida Atlantic University. I'd like to welcome you to the show. He's also a 7th degree black belt in karate, by the way, so we're not going to mess with him tonight on the studio, on the set.
Thank you, Pat.
Dr. Mencia, it's interesting to hear that you are the founder of an unusual institute here in Fort Lauderdale, something new and different, something we like to talk as one-stop shopping.
Right.
Tell us about that.
What we have done is basically created a center, a geriatric center, where we have geropsychiatrists working with us, geriatric dentistry, we have podiatrists, gastroenterologists, pulmonologists, and the center basically is spearheaded by us, the geriatricians, and the geriatric nurse practitioners that work right along with us with direct supervision by the medical doctors.
You know, one thing that we were talking about before the show began is how frustrating it is. You hear so many elderly people who are frustrated because they have this doctor on Monday and this one on Tuesday and another one on Wednesday, and in some cases, if they're not feeling well, they have to find somebody to drive them to their appointments, and it gets very, very frustrating, and people feel like all they do is go to doctors all the time and sit in waiting rooms, and it's very discouraging. It's debilitating, and it takes away from the time in life that's supposed to be enjoying, and it's not enjoyed.
And sometimes, you know, the care of the patient start lagging off because one doctor might not be communicating with the other doctor. In the center, at least, we are forced to communicate with each other because we might be seeing 2 or 3 specialists might be seeing the patient on the same day. And we sit down and we discuss the case. Another thing that we provide in the center is that we have a chaplain that works with us. And Rabbi Israel has a lot of knowledge on the medical field and also in geriatrics. So he's an excellent asset to the community to have there.
What got you started in this?
In geriatrics in general? Mm-hmm. Well, my grandfather was my inspiration. He lived to be 108. He was a person that did not take any medication. He would take aspirin if he would have a headache. And he lived very happy until the day he died. He basically was ambulating and
didn't
he
use
was
a cane,
farmer.
you said?
He never used a cane. He was a farmer. He used to get up at 3:30 in the morning every day, go and work the land, and he was a happy man.
And he lived to be how old?
108. So
that
was my inspiration. I wanted to be able to practice medicine and provide care to the elderly with a lot of pride and honesty to them.
Mm-hmm. Quality of life, it's so important. One of the things that's frustrating is people that feel that a lot of the things that happen as we get older are just because it's old age, we're to expect it. And yet we see other people who seem to be doing better. And a lot of the times the excuse is, oh, well, it's in their genes. Mm-hmm. Is that right?
No, that's wrong. That's wrong. One of the things that if we learn anything tonight is that we should never take for answer that your problem is related to your age. Your problem is related to either an organic or a psychological problem, but never related to your age. One of the things that we never want to do, you can be 18-year-old or 98-year-old, you don't want to, quote-unquote, drop the tower. You want to have a good immune system, and for that you need to have the spirit to fight. And once you lose the spirit, you lost the battle. So you need to have the spirit. It could be fighting a cold, or it could be fighting pancreatitis. You have to have the spirit to fight. Mm-hmm. And those one with a good spirit will come out winning.
Yeah, that's
Absolutely.
a good way to think about it. I do want to remind our viewers that our phone lines are open, and if some of those of you who consider yourself to be geriatric are wondering exactly what that definition means, here's a specialist that serves the elderly population, and he can answer a lot of your questions. So please call the number on your screen, 527-5007. We are in Fort Lauderdale speaking to you live, and we can take your phone calls tonight.
And those of you that want to become a geriatric one day in your life, you can call and ask questions to what to do to live healthy and make it there.
Make it to that
Yes,
to a ripe old age. Well, let's decide what age does constitute geriatric.
That's an interesting question, Pat. When I started in the field of geriatric medicine, it used to be 65 years and above. And what we started seeing was a trend of people coming much younger. So now the bar had dropped to 50 years and above. So we get a lot of people coming younger, and what they want to do is practice preventive medicine. They want to come to me and say, you know, if I'm going to develop memory problem, if it's related to a vitamin deficiency, can you fix it so I won't have the memory problem down the road? And
in that case, for example, what is it that you recommend to people?
Basically, in general, to get frequent checkup with your primary care doctor, not to go and see a doctor when you have a problem. Some people have the attitude, I will only see my doctor if I have a medical problem. If I don't have one, why should I go there? So you want to go and get frequent checkup to practice preventive medicine. You want to exercise, and you want to eat right. If you can log in, and most people now are logging into the computer, we are losing the fear to using the computer. If you can log in, there's a lot of recommendation by the American Cancer Association, the American Heart Association, the American Diabetic Association. You get a lot of recommendation on the kind of diet that we can follow. And you can log in, you can read at your own pace, and prepare yourself even before you see your doctor.
All right, well, in the case of a lot of the old elderly population, many of them are not computer literate. They don't have computers. They don't know how else to use them except for the email to get the messages from relatives. Mm-hmm. So what do you suggest? Say somebody comes to you and they're in their 50s and they say, I'm afraid I either have Alzheimer's running in my family, or I'm just afraid that as I'm getting older, I'm starting to forget things. You know, do you recommend certain vitamins for that, for example?
Yes, but the first thing we do is make sure that their concerns are based on factual material, like if people are getting Alzheimer's in the family, at what age the tendency of the Alzheimer's is presenting. Is it in their early 50, which is sort of young, in their 60, in their 70, more average? And if so, then we drop 10 years from there and we start checking the individual that is coming to us, the immediate relative of the patients with Alzheimer's disease. So we want to start being more aggressive once you are getting closer to the average age the people in the family are getting Alzheimer's disease. Then the next step is to do a screening for condition that will mimic Alzheimer's disease, but they are treatable, such as vitamin deficiency, B12 deficiency, folic acid deficiency, a thyroid that is sluggish or hyperactive, a kidney that is sluggish, or a liver that is not processing medication well.
You mean the kidneys and the livers can have or a vitamin B12 deficiency can have an effect on memory?
On your memory. Another condition that is very common is depression. Depression will mimic Alzheimer's disease. And once you treat the depression, just like magic, Alzheimer's disappears. Well, it's not a normal course of Alzheimer's disease.
Mm-hmm. You had spoken earlier as we were coming into the studio about one of your patients recently that was under hospice care, and many of our viewers know that when one is in the hospice care, their primary care doctor has given them a time limit of about 6 months.
Exactly.
What happened with this person?
I had a lady that came in with her daughter that was visiting her. And she said, I just want to get a second opinion because she didn't feel comfortable. When she will approach the primary care doctor and say, you know, what is the reason, what are the reasons that my mother ended up in hospice? He said, well, she has too many little problems that had add up and put her into hospice. When I did my assessment, I noticed that the main problem that she had was the different type of medication that she was taking. She was taking medication given to her by the cardiologist that was contradicted the medication given to her by the urologist. And then the primary care physician was giving his own little input of medication here, and they all were contradicting each other. And when I did my full assessment, I didn't have one diagnosis that I can say this is a terminal condition. She didn't have terminal congestive heart failure, terminal emphysema, terminal Alzheimer's disease. So I told the daughter my recommendation was let's put her into the hospital and let's do a more comprehensive assessment on her. We remove a lot of the medication. Her kidney was failing on her. I called a nephrologist to come and work right along with me. We got her off of the medication. The lady walked out of the hospital.
And how old was she?
72.
She was 72 and she had been diagnosed as 6 months left, and
right.
Now,
She lives back home by herself.
By herself?
She takes care of herself. She goes shopping. Now she's my patient, of course.
a little side
Needless to say, right?
Right.
Now she's my patient. She wouldn't
Yeah.
go back to the doctor.
And is she reduced in the amount of medication she's taking?
She had reduced. She takes much less medication now, and she takes medication that she really needs. Sometimes we run into this spiral of condition with the elderly patient that they give you one medication, that one medication will produce a side effect. Then you come in with a side effect, and now we treat the side effect. For example, you come in with your blood pressure high because you are nervous. So we say, okay, you have hypertension. Let's treat the hypertension. So they give you medication for hypertension, but because you really don't have hypertension, now you come in feeling dizzy and wobbly and you're falling all over. So now we're going to give you an anti-birth for that. Now you're getting headache and you feel nauseated and your appetite is dropping. Now we have to give you an appetite stimulant, and we got to give you another medication for the headache. And sometimes we go into this spiral of medication, and this is what we call those walking pharmacy going around.
Right.
And a lot of times is once we start misusing medication. And that's why it's important that we become a smart consumer when you go to your doctor. Be prepared when you go to your doctor. Make sure that you understand the symptom that you are presenting and when did those symptoms begin. Can you pinpoint any relationship with those symptoms, anything that has happened to you along with those symptoms, so that your doctor will be better prepared to provide you with the right type of medication.
Okay. Well, Dr. Andres Mencia is the founder of the Geriatric Institute of Fort Lauderdale, Florida, and that is located in Fort Lauderdale. Tell us about where it is and a little bit more about it.
We are located in 1608 East Commercial Boulevard. We have private parking lot, so everybody that come in will just come to the Geriatric Center. It's not a building with a lot of different offices, or all the offices in the building are geared toward care for the elderly. We are open Monday through Friday, but sometimes if required, we do go in on the weekend. Part of the services that we provide, some of the elderly patients are homebound, and those patients will not get good medical care because there are not too many doctors that will go there. We have a team of doctors that will visit the patient when they are homebound and will provide them the same care that we provide in the office.
You mean you make house calls?
We make house calls.
Doctors don't make house calls anymore.
Well, I have
do.
I have one patient that he came from England. And in England, still nowadays, a lot of doctors still make house calls.
Right, I've heard that.
And he was so surprised. He called 3 or 4 different hospitals and said, I'm looking for a doctor that will make house calls. And he kept on bumping into my practice.
Oh.
And he said, well, let me call this guy. He's the only one, I guess, that make house calls. So we do make house calls.
Well, that's wonderful.
We also have an outreach program for the retirement communities. And we have a team of doctors and nurse practitioners that go into the retirement community, including myself. We go into the retirement community and provide good medical care for those people that ended up in a retirement community for whatever reason. We also go into the nursing homes and try to provide the same level of care. We want to provide high level of geriatric care at all the spheres of our community. We pride ourselves for doing continuity of care, meaning that if we pick up a patient at home and that patient ends up in the hospital, we are the team that follow the patient in the hospital. If the patient from the hospital now going to a short-term rehabilitation center. We'll follow that patient there so that we can close the circle and bring the patient back home. We have many patients that, among their wishes is that they don't want to be intubated, they don't want to end up in a nursing home, and we try to respect their wishes at all costs.
Mm-hmm. Well, it is unusual because one of the things that you hear so often, as I said at the opening of the show, is that people just feel that all they do is go from doctor's office to doctor's office and sit in a waiting room, and then when they get home they have all these pills lined up on the counter and they say, look at all these pills that I'm taking. I don't want to be taking the medication anymore, but they're afraid if they take out one and just decide not to take it, they'll have a terrible side effect, maybe death. And it's frightening, and it's unusual to have a place where somebody can come and hear about a team of doctors. Because years ago you used to hear people say, oh, I have a team of doctors looking into this. And the reality is now that's not the case. As you said, you go to one doctor for one thing, and that person doesn't get on the phone with their busy schedule and call the next doctor that you go to and say, don't forget, this person is taking this. Exactly. It's like your chart. You have to carry it around with you and hope that everybody's checking it. And that doesn't often happen in the outside world. It may happen while they're in a hospital, but it doesn't happen.
I met Pat about 3 years ago, one lady that I call Bubbles. I met her about 3 years ago in the emergency room. She came in with exacerbation of asthma. She was intubated. And once we got her off from the breathing machine, I asked her, well, how frequently do you come to the hospital and how frequently you get intubated? She said, at least once a month.
She was a regular visitor.
I said, you're going to be at a point that you're going to be putting the tube yourself and then call 911.
Right.
And I worked with her, Pat, and last year she got one exacerbation that ended up in the hospital. And this year, thank God, no exacerbation. And just with the medication management that we have. But sometimes I have to see her weekly. She knows what to do now. I have a regimen for her, and I say, when you start wheezing and you start getting this symptom, this is your regimen, this is your recipe. And Bobo has her recipe, and she knows what to do. When she come and see me, she say, oh, I had an exacerbation 3 days ago. I started my prednisone, I started my antibiotic, I'm doing this, I'm doing that. And I'm doing much better.
Oh, good. And she's probably a lot happier.
Oh, absolutely. I don't. You and I won't want to be in a ventilator once a month.
No, I can assure you that. Well, we're going to take a brief break and hope that maybe some of our viewers will call and ask you some questions about this new and unusual practice that you have at 527-5007. That's our phone number where you can call into us live here in the studio. In the meantime, we're going to take just a brief break, so stay with us.
Healthy Living is brought to you by
the voice is okay, right?
Hospital District.
Just knowing your risk of cancer can improve your odds. You probably think it could never happen to you, but prostate cancer is a leading killer of men in the United States. Fortunately today, with early detection and treatment, prostate cancer can be cured. Learn how to recognize your risks and the early warning signs of prostate cancer. Call 1-888-899-8188 and ask for your free cancer care kit and risk profile. Cancer care services at the North Broward Hospital District. It's your life. Protected.
I am American.
I am an American.
I'm an American.
I am American.
I am America.
I'm an American.
I am American.
I am an American.
The tragedy of September 11th was meant to cause fear among all Americans, including our children. We can't let that happen. Talk with your kids. Listen to them. Tell them that they are safe and that they are loved.
I've always loved working on computers, and in the Army, that's what I do. I set up networks, I troubleshoot, I basically do things I would have never dreamed I'd been able to do before.
If you never thought about the U.S. Army or Army Reserve, think about this. There are 212 ways for you to become a soldier and work at a job you'll love. Call for this free video to find out which job is right for you.
I'd never really thought of the Army as a choice.
Your free video will also give you an idea of what Army life is like, how you can earn money for college, even what questions to ask your recruiter.
I'm going to walk away with a lot of memories, a lot of friends, and something that's going to change me for the rest of my life.
Call the number on the screen right now. and discover the 212 ways you can be an army of one.
If you would ask me a year ago if I'd be here doing this, I could have never imagined it. I love what I do. I love doing it for the Army.
Hello and welcome back to Healthy Living. I'm Pat O'Meara. We're speaking to you live from the studios tonight, and we have as our guest Dr. Andres Mencia, who is the founder of the Geriatric Institute here in Fort Lauderdale, and he's also part of the Broward Hospital District. Meanwhile, Joan's been holding on the phone. Joan, thank you for holding while we had that public service announcement. You have a question for Dr. Mencia?
Yes, I do. I'm an owner of an adult family care home. I have 5 seniors that presently reside in the home, and I'm running into difficulties. Some of the seniors are not able to go out into the community to access health care. And since you do come into the home, you do home visits, do you accept Humana or HMO health plans?
John, first of all, I want to congratulate you for serving the community in the same direction that we have been doing. I do go into some of those facilities, more like that. I have 4 and 5 residents, and we do take care of them. Unfortunately, we do not accept HMO. What we have in a plan to help patients, like in your situation, is that we have make a contract with AdMed HMO. And if you talk to the family of your residents, and if they switch them to AdMed, then we can go there and provide care.
Okay.
So we do work with AdMed, John.
I see. What is your telephone number that I can contact you?
My phone number is 489-1345.
1345. Okay, thank you very much. Your show is very interesting.
Thank you, John. Thank you for your call.
Thanks. And now we have Rich from Lauderdale by the Sea. Rich, thank you for holding. You have a question for Dr. Mencia? Good evening, Rich. We're trying to get the phone call back in again because when Joan was on the line, we had another line that we had to take. It's good to know what coverages people can get because that's an important part of their concern.
Absolutely.
Everybody's fortunately has to have some kind of insurance today or they don't get any medical care whatsoever. And so it's important to know that you do carry, what were the other medications?
Well, usually,
insurance,
right. Usually we carry Medicare and then any other PPO.
Okay.
So with the PPO, you can go to any doctor you want, and there's no limitation. As far as HMO, because a lot of patients with HMO were paying out of pocket, what we did, we made a contract with one HMO, so the patient that want to see us will not have to pay out of pocket anymore. So we accept AdMed.
I see.
As the only HMO that right now we are contracting with.
Okay. Well, that's good to know because I'm sure it's easier for one to, like Joan, to have this set up in their facility so that if your doctors are able to come and make the house calls and determine what all the needs are, then you can bring everybody to them.
And I just wanted to motivate John. There's one facility that I go to that have a little over 50 residents, and half of them were private insurance, that was no problem, but the other half that had HMO, when they contacted the family and they were informed that we were specialists in geriatric medicine, 100% of the resident on HMO switched to AdMed so that we could see them and provide continuity of care for them.
Okay.
And we will assure John that once we take care of her patients, we will bring those patients back to her. Because that's one of their concerns. They get attached to these people, and they take good care of them, and they want to make sure that those patients come back to them.
Of course. We have Joe on the line from Pompano, so let's take this call. Joe, thank you for holding. Welcome to Healthy Living. You have a question for Dr. Mencia?
Yes, thank you. Hello, Dr. Mencia.
Hello, Joe.
Hi. Could you tell me more about your geriatric and the services that are offered?
Sure, Joe. In the center, we try to provide basically total care under one roof. So what we have is different specialists that will work in coordination with each other. And I was telling Pat before we went on the air, we had this 94-year-old lady that came for a geriatric assessment, She was having diarrhea that was very hard to control. And on the way to my office, her bridge broke.
Her teeth.
Right,
Okay.
the bridge of her teeth broke. And so we have the gastroenterologist see her right after me, and we have the dentist walk down into the room and made a bridge for her. So we have the comprehensive type of care, the multi-specialty care. Patient will come in, it's like a menu. You can pick and choose. Some people will come in and see just the geriatric dentist. Some people will come in and get just bright smile, which is a procedure that takes about 45 minutes total. Some people will come in and say just see the dentist and see the podiatrist. Some people will see the gastroenterologist and the geriatrician. We also have the pastoral care. So some people that come in that have what we call caregiver stress syndrome because of the complexity of the care of their loved one, they might spend a lot of time with the chaplain discussing the condition and the kind of thing that they can do to help them deal with the situation better. So that's within the center, Joe. The other thing that we also do, like we were explaining a little bit earlier, is we do the home visit, and then we have the outreach program where we'll go to this other facility and try to provide the same level of care at those facilities.
I hope we've been able to answer your question. It's a unique process, and it's something that's new and upcoming and maybe a long time in coming, because it makes it so much easier, especially as you mentioned for the caregiver, if you can take the person who needs all of these services and bring them to, as I said, one-stop shopping. They can see specialists in different areas and help to have their questions answered. Meantime, we have Rich back from Lauderdale by the Sea. Rich, welcome back. We only have about 3 more minutes left in the show, so I'm going to ask you to briefly have your question and then, Doctor, for you to address it.
The question has to do with dentistry. Does the dentist make home calls? Because some of the bedridden people, you know, their gums shrink, and if they could just take impressions and you know, make a reline, it would be a great help.
Rich, I want to, first of all, thank you for coming back on the line, because your question is excellent. It's an excellent question. Not only my dentist makes house call, the whole staff will make house call, the gastroenterologist, the pulmonologist, the podiatrist, and the dentist will make a house call with do some cleaning in the house. They will bring their equipment with them to do the basic needs of dentistry. And they will take impression and will set, you know, arrange, fix a bridge and what have you. So we do, you'll be surprised the amount of things that we are able to do in the, at home. The only thing is that don't get scared when you see all the equipment. You think your bedroom have become an operatory, but everything will go back when we leave.
Thank you very much for calling and for calling us back, Rich. I do want to say that once again, Dr. Mencia here is a 7th-degree black belt, so he gets these geriatric patients feeling so well that after he's done with them, they're all taking karate lessons.
Well, I do motivate them to exercise. I like them to walk. You know, walking is an excellent exercise to prevent osteoporosis. I have one of the geriatricians that work with me, Dr. Dean Pham, and he's an excellent instructor in meditation. Yesterday I was interviewing Dr. Virginia Pham, who specializes in Chinese medicine and acupuncture. And I was telling her how proud I would be to have something like that add on to the center.
Well, good. It's going to be can become a center that's Broward Hospital District is certainly going to be proud of. We thank you for being on the show. We hope to have you back again, and maybe we can show some pictures of the Geriatric Institute in Fort Lauderdale on Commercial Boulevard. And your number we are going to show on the screen one more time as we leave the show this evening, and we welcome you to look at healthy living again, this time next week or the week after. Maybe we're taking a holiday break, but we look to having you back again, and we wish everybody a good evening and happy holidays.
Thank you, Pat, for having me on the show.
You're welcome.
Good night.
We didn't have a chance to talk about the sensitivity medications, but it's just so...